I'll now start the discussion on lesson 1, which is all about basic principles of pharmacology. Now, under the lesson 1, I have decided to divide the lesson into five topics. First, we will be defining terms, okay, particularly important pharmacological terminologies, followed by the important concepts in pharmacology. So this is all about the branches ng pharmacology. Then we will also discuss the different or general classifications of drugs. And then finally, the principles of pharmacodynamics and pharmacokinetics. Now, mind you, class, yung last two, okay, the pharmacodynamics and the kinetics, this is the two primary branches of pharmacology. So please take note of that. Two primary branches of pharmacology, the dynamics and kinetics. So yung goal ko ngayon is matapos yung first three, definition of terms until classification of drugs. So let's start with the definition of terms. First, of course, we have to define first the subject matter itself. What is pharmacology? Now, class, ang pharmacology, this comes from the Greek word pharmakon. Susulat nyo, pharmakon. And according to the modern Greek, pharmakon means drug. Okay, that is why when we define pharmacology, this is all about the study of drugs. Okay, particularly it studies the biological, the physiological aspects, even the therapeutic aspects of drug effects. Okay, including the absorption, the distribution of drugs, the metabolism of drugs, and the excretion of drug, or simply that is ADME. Okay, ADME, take note, absorption, distribution, metabolism, excretion. That is also under the general pharmacology science. Okay, then we will also study the adverse effects of drugs. Also, that is being covered by toxicology, so toxicity of drugs. And we will also discuss the mechanism of action of drugs. Okay, yung specific nila na mechanism of action. Okay, so main focus talaga ng pharmacology is all about drugs. Okay? So ang tanong, ano ba yung drugs? Okay? So we have a broad definition of drugs. It could be any substance that brings about biological change or physiological change sa living organism. Okay? Or this could be any chemical substance that has the ability to modify the body structure or the body's functioning. So, halimbawa, yung stomach natin, di ba, normally, yung environment niya is acidic. Okay, so that's a normal environment of our stomach. However, if a patient is suffering from hyperacidity or may ulcer siya, syempre yung acidic environment ng stomach, too much acidity no ng stomach needs to be managed. Kaya diyan papasok yung gamot no. Meron tayong gamot that could alter that could change the functioning, the normal functioning of our body. Okay, 'di ba? Meron tayong gamot for hyperacidity. So halimbawa, Kreml S, no, mga antacids, bina-alter nila. Yan yung ibig sabihin ng drugs in general. They modify, they're able to alter body's normal functioning. Now, we also have a therapeutic definition of drug. This could be any agent used for the medication, diagnosis, pwede din for the prevention, the treatment, cure of diseases in human and other animals. So this is quite familiar to yung definition because kanisya mismo nga definition is coming from your USP. No, USP definition. Makikita to sa reference book niyo na DDS. Diba na may drug delivery system, no, sa last semester. And when you define that, it could be any article no, ginagamit for this, okay, purposes. Treatment, diagnose, cure, medication. So that's a USP definition naman ng drug. Okay? Now, considered as poison already kapag ang chemical agent produces a harmful effect. So that is already a poison. So halimbawa, ng harmful effects, it may cause injury uh, to a human, no, to the a living organism. Okay, pwede din ang harmful effect is makakause siya disease. Okay, so that is already considered poison. Okay, or death. Kapag nagkakause yan ng death, that is already poison, no? Considered na yan as poison. And in this environment, iba-iba yung klase ng poison. Meron tayong poison nga metals, no? Metallic poison, meron tayong mga industrial poisons, may mga agricultural poisons. Ayan. So yung being stated there as an example, yung arsenic and lead, these are examples of metallic, no? Metallic poisons. And you have encountered this sa PChem 1 natin, di ba? We have learned different poisoning of metals, of elements. And if you can still remember, si arsenic, it has a poisoning. No? Yung poison being caused or the toxicity caused by arsenic, yan yung mist lines, yung nagkakaroon ng white patches. Okay? Sorry. Ayan. White patches sa fingernails, may puti-puti sa fingernails. Yan yung mist lines, yan yung toxicity ng arsenic as a metal. Lead is also considered poisonous. Yung lead, it could affect different systems in our body. Halimbawa, it could affect the CNS, okay, causing encephalopathy. It can affect GIT, no, yung gastrointestinal tract natin, causing constipation. Pwede din yung blood is being affected with lead. So, yan yung mga harmful effect ng lead, halimbawa. Okay, it can cause anemia sa blood. Okay, to be specific. So, again, kapag isang chemical substance produces harmful effect, it is already considered poison. And please take note of this, class. Okay, erase ko muna dito nga part. Take note, any drugs in high concentrations, they become poisons. Okay? Kung too much na, syempre, too much of that, of the dosage of that particular drug, okay, that is already poisonous. Okay? Makakause na siya mga adverse effects, harmful effects sa katawan. That's why meron lang tayong mga specified, di ba, nga dosage for a particular medicine, for a particular drug. Okay? To manage a specific condition of a patient. Okay? So, yan. So, tandaan nyo yan. Drugs in high concentration, they become poisons. Okay? Now, kapag naman ang poison, okay, is of biological origin, that is specifically termed as toxin. Okay? It is also a poison, but of natural yung origin niya. Kumbaga, produced naturally siya. Okay, yan yung toxin. So, halimbawa, kapag biological origin, galing siya sa plants, galing siya sa animals, galing siya sa bacteria. No, those are biological origin ng toxin. So, yung given na example dyan, tetrodotoxin, that is a potent nga poison that is found sa liver ng pufferfish. Okay? 'Di ba meron tayong mga animals, okay, nga ga-produce of toxins, okay? So yan, halimbawa yan ng toxin already. Tetrodotoxin, again, galing ito, or this could be found sa liver or gonads ng pufferfish. Okay? Ayan. So, ayaw na masulat, no? Okay? Or sa mga toadfishes, so usually sa fish na siya ma-acquire ang tetrodotoxin. Animal origin na siya nga klase nga toxin. Sa plants, di ba? Napunta yung mga plants nga poisonous. So, kato ilang gina-produce, toxin na. Considered as toxin yon kasi biological origin. So, halimbawa, mushrooms, di ba? Familiar tayong mushroom, meron tayong, meron siyang poison, di ba? Yung part, no, ng mushroom. Or meron ding klase talaga ng mushroom na poisonous kasi nagpo-produce siya ng too much toxin. Okay? So, sige lang, you will learn that sa inyong pharmacology. I think naamoy pharmacology karon nga subject. So, you will be learning all of that. Okay? So, that is for the definition of terms, no? So, yan lang yung i-define natin. Now, let us proceed naman to the branches of pharmacology. So, I have mentioned earlier that uh, we have two primary branches of pharmacology. Actually, there are numerous. Maraming branches ng pharmacology, but we have two primary or main branches ng pharmacology, and those are the kinetics and the dynamics. Now, when we talk about pharmacodynamics, ito yung branch of pharmacology that deals with, sulat nyo, it deals with the biochemical, okay, and also physiological effects ng drugs. Physiological effects of drugs, okay? When we talk about biological, physiological effects of drugs, that is also simply mechanism of action ng drugs. So, yan yung heart ng pharmacodynamics, mechanism of drugs, okay? Or in operational terms, pharmacodynamics, it is what drugs do to the body. Ano ba yung ginagawa ng drugs to the body? Siyempre, to produce effect, to produce a specific mechanism of action. Okay? So, yan yung covered under dynamics. What the drugs do to the body. And then, nagbibigay siya ng MOA, mechanism of action, effect. Okay? So, tandaan niyo yan, drugs to body. Dynamics. Ano naman yung pharmacokinetics? Ang pharmacokinetics naman, it studies the fate. No? It studies the fate. Ano yung destiny or disposition ng drugs? Ano yung magiging destiny niya kapag na-introduce na siya sa katawan ng tao? What do you think will happen to the drug kapag na-introduce siya sa katawan ng tao? Siyempre, it will be absorbed. Diba? Yan yung magiging fate ng drug. It will be distributed. It will be metabolized inside the body. And then, later on, it will be excreted. So, yan yung fate ng drug kapag na-introduce siya sa katawan. Kaya nga, in operational terms, we define pharmacokinetics as what the body does to the drug. Ano yung ginagawa ng katawan sa gamot. Ano ba yung ginagawa niya sa gamot kapag na-introduce? ADME. Yan yung sagot. ADME. Ang ginagawa ng katawan, gina-absorb niya ang drug, gina-distribute niya, gina-metabolize, then later on, it will be excreted. So, tandaan ito kapag, bakit letter K? Kapag body to drugs, kinetics. Okay, so just take note of this, no? Naghatag ko og para madali lang siya matandaan. Katawan to drugs, kinetics. Okay, drugs to body, dynamics. Okay? So later, para mas ma-reinforce pa siya, ma-mention ako siya sa mga next few slides, no? Itong dalawang main branches of pharmacology. Okay? Now, aside from the two primary branches of pharmacology, meron din tayong other branches relevant also to the study of pharmacology. Okay, so the other branches, halimbawa, we have, pharmacotherapeutics. Okay, so pharmacotherapeutics from the word therapeutics. No, this is focused more on therapy. No, it is more focused on therapy, on the management, the intervention that we gave to manage the disease of that particular patient. Okay, so this is more on the rational drug use. Diba? So kapag rational drug use, dito papasok yung mga rights of medication administration. Ano ba yung mga mga rights na kailangan tandaan for medication administration? As a pharmacist, dapat we always make sure nga we dispense, di ba, the right drug. Yan yung una, we dispense the right drug. Then, it has to be dispensed with the right dose. No? Right drug with the right dose. Saan siya ibibigay? To the right patient. Okay? And then, paano ba tinitake yung gamot? It should be taken at the right time. No? At the right time. Then, saan? Ano yung route of administration? Dapat right route of administration din. Okay? So, yan yung kailangang tandaan, no, kapag rational drug use. You always make sure that we dispense the right drug with the right dose to a right patient, taken at the right time, in the right route of administration. Okay? So, that is very important. Now, yan yung all about pharmacotherapeutics. So, tandaan ha, therapy management. Now, let's have pharmaceutics. No, yung pharmaceutics in operational terms, this is what the pharmacist do, no, to the drugs. Okay? What the pharmacist, wrong na siya, what the pharmacist dapat do to the drugs. Okay? Ano ba yung contribution ng pharmacist sa mga medicines, okay, available in the market? Ano ba yung contribution halimbawa ng mga chemists or any pharmaceutical maneuvers to a drug? Of course, they are more likely involved sa preparation ng dosage forms. Now, you give me an example of a dosage form ng drug. If you could still remember, ano yung term nga dosage forms? Halimbawa ng dosage forms ng gamot. Okay, very good. Okay, at least you know already the terms. Kapag dosage forms, that is example, tablets, no? Preparation of tablets, capsules, solutions, elixirs, yun. Okay, so yan yung pharmaceutics. Diba yan yung all about pharmaceutics? And you have learned this last semester. Yes, very good. Ointment, okay? Paste, no? Ayan. Suppositories, yun. If you know already the dosage form, you know what is the route of administration. Kasi iba-iba, di ba, yung route of admin kapag, depende yan sa dosage form na ng gamot. Okay, so that's under pharmaceutics. Ito naman yung pharmacogenetics, so another branch din ng pharmacology. Ito naman, it deals with the study of genetics, so all about genes, genetic influences on responses to drug. Under pharmacogenetics, meron itong sub-branch, no? Yung pharmacogenomics, under yan sa genetics. Ano ba yung pharmacogenomics? Pharmacogenomics, this is a branch, yun na nga, a branch of pharmacogenetics, which makes use of genetic information ng individual, okay, or ng patient, genetic information ng patient para guided ang mga healthcare workers for the choice of drug therapy. Okay, kumbaga, meron kasing mga certain cases tayo sa hospitals wherein posibleng, halimbawa, may mga set of individuals, may mga set of patients, parehas lang sila ng sakit. No? Parehas sila ng sakit, pero nung binigay na yung gamot, magkakaiba yung responses ng katawan nila with that particular same therapy provided to them. And doon papasok si pharmacogenomics kasi with pharmacogenomics, it could predict, no, the differences, yung differences sa responses ng mga patients regarding that gamot na binigay, pwede yan ma-predict under pharmacogenomics. Aaralin lang yung genetic makeup ng patient, okay, para malaman ano yung relationship nila ng genetic makeup niya sa response to that specific drug. Siyempre, iba-iba kasi yung genetic material natin, di ba? Pagkakaiba. So, pwedeng isa yan sa factor. Bakit magkaiba yung response ng katawan mo to that drug? Then, sa kanya naman, iba din. Okay, so pwedeng ganun. Okay, so that's pharmacogenomics. Next, pharmacoepidemiology. So epidemiology. This is also talks about drugs effects. Drugs effects then it studies the effect of drug, but not on the individual basis, no, not on individual patient, but on a population level. So tinitingnan yung effect ng drug on a larger population, hindi yung pang-individual. Okay, so yan yung pharmacoepidemiology. Then, pag pharmacoeconomics naman, syempre, it has something to do with a cost, di ba? Cost and benefit, di ba? Ganyan naman talaga kapag health economics. Okay? So, kumbaga, branch siya ng health economic that aims to quantify. Okay? Yung quantify in economic terms yung cost tsaka benefit ng drugs that is being used therapeutically. So, tinitingnan hindi lang yung benefit ng drug but also ano yung ilan yung magiging cost no ng drug na yan. Okay, so that's under pharmacoeconomics. And then finally, we have toxicology. Okay, toxicology or the pharmacotoxicology naman, ito yung branch ng pharmacology that deals with study of adverse effects, yung toxicity ng drug. Okay, ano yung mechanism of toxicity ng drugs. Okay? This is the opposite of the pharmacodynamics kasi yung dynamics, it's the mechanism of action, the MOA. No, yan yung dynamics, MOA. Ang toxicology, MOT, no, mechanism of toxicity. Okay, so overall we are done with the branches of pharmacology. And again, the two primary branches ng pharmacology, it's the pharmacodynamics and kinetics. Sige nga, you type in your answer. Kapag it talks about what the body does to the drug, ano yon? Is it dynamics or kinetics? What the body does to the drugs? Okay, very good. Pag body to drugs, it's the kinetics. Okay, kapag naman what the drug do, or what the drugs do to the body. What the drugs do to the body. Okay, very good. It's the dynamics already. So, tingnan nyo lang yung starting letter no sa root no root word. Dynamics starts with letter D, so drugs to body. Kinetics starts with letter K, katawan, so body to drugs. Let me ask you, ano ba yung ginagawa ng katawan sa body? Ano yung abbreviation natin? Ano yung ginagawa ng katawan sa drugs? What does the body does to the drug? What is the answer? Okay, very good. ADME. Ina-absorb, distribute, metabolize, and excrete. Okay? So that's it for the branches of pharmacology. Okay, so this time, let's go back to the very heart no, of pharmacology. So sabi ko kanina, ang pinaka-heart of, ayan, sorry, hindi ko na-delete no, yung highlights. Yung heart of pharmacology, again, is all about drugs. Then we have defined this, no? Drugs in a broad definition and also in a therapeutic definition. So sabi kanina, kapag drugs, it is able to alter, it is able to modify body structure, the body's function. Now, by chemistry naman, kapag tiningnan yung structure ng mga drugs chemically, so chemically, we can define also drugs. They are usually low molecular weight chemical substances. Okay? That interact with macromolecular targets in the body to produce an effect. Now, with regards to this macromolecular targets, kindly highlight. Ayan. Yung macromolecular targets na yan, that could be in the form of proteins. Diba? Proteins, we could abbreviate them as CHONs. Okay? Kasi proteins contains carbon, hydrogen, oxygen, and nitrogens. Okay? So it may be a protein, no, ang target ng drug, or it could be a nucleic acid. Okay? Pwede din nucleic acid in the body. So kung atong i-analyze ang definition chemically, we can still infer na may close relationship talaga yung drug tsaka yung body. Meron silang close relationship. Drugs to body. Okay? Kasi nga, for a drug to produce an effect, for a drug to produce an action in the body, that drug must be powerful enough, no? That drug must be selective enough to target proteins or either nucleic acids in our body, no? But the next question here, kahit powerful pa yan, selective enough pa yan yung drug, how can it reach the body? No, how can it reach the body? Syempre, the body will also participate, no? Ang drug can only reach the target site in the body if the body will also interact with the drug. Kaya meron talaga silang relationship, no? So by relating drug to the body or vice versa, meron talaga tayong two main concepts, no, under pharmacology that would really help us explain the relationship of this two. So yun na nga, una, for a, let me change the color. Okay. Paano ba to? Ayan. So una, di ba, for a drug, ayan, drug to body concept, okay, yung powerful and selective interaction ng drug sa katawan, we must consider the field of pharmacodynamics, no? Pharmacodynamics. And the detailed discussion on pharmacodynamics, we will have that on lesson 2, no? And I have provided already the PDF handouts on that. So tandaan, the mechanism of the drug, okay, as it interacts to the body, producing an effect, that is pharmacodynamics. Now, on the other hand, when the body naman, and the body interacts with the drug, or the way the drug, I mean, the way the body accepts the drug, then ang tawag naman natin dyan is pharmacokinetics. Yung way paano i-accept ni body yung drug, kinetics yun. No? Kasi ADME yung ginagawa ni katawan sa drug. Okay, so meron talaga silang close relationship. Okay, kinetics. Okay, so itong dalawa, pinaka-importanting concepts ito in relation to pharmacology. Let us proceed to our next topic. Okay, so at this juncture, let us discuss, ayan, nag-log siya. And so let us discuss the classification of drugs. So generally, we have 4 classification of drugs. We have the functional modifiers, replenishers, diagnostic agents, and chemotherapeutic agents. So we will start with the first classification of drugs. We have the functional modifiers. Now, when we say functional modifiers, these are agents, no? Ayan, nag-log siya. These are agents that modify or alter physiological or biochemical activities of cells in the body. So from the term itself, modifiers ng function. So they are able to modify, alter the functioning of the body. So targeted niya yung mga biochemical activities sa cells. I repeat, targeted niya yung mga biochemical activities of cells in the body. So halimbawa, we have colchicine. No? For you to understand why colchicine is classified as functional modifier, of course, we have to discuss the MOA, no? The mechanism of action ng colchicine. Para saan ba yung colchicine? Are you familiar with colchicine? Saan siya ginagamit? Anong klaseng sakit? If you have an idea, you can type in your answer. Yes, very good. Colchicine, this is the first line. Okay, very good. It's the first line for the management of gout. Okay. Now, for us to appreciate the mechanism of action ng colchicine as anti-gout, we have to uh, analyze first. Ano ba yung klase na sakit yung gout? Ano ba yung nangyayari kapag ang patient may gout? Okay, tsaka natin ipapasok si colchicine. And that's the time ma-analyze nato, functional modifier talaga si colchicine. Okay? So, let us have a short overview muna sa sakit na gout. Ano ba yung gout? No? Ano yung gout? Now, with regards to gout, common manifestations or clinical manifestations kapag ang patients may gout is una, uh, mataas yung uric acid sa blood level. Okay, mataas yung blood uric acid. Okay, blood level, uric acid in the blood. Okay, so that's one of the manifestation. Now, if that is the case, tinest yung blood mo, tapos mataas, no, yung uric acid, then potentially you have this disease, no, may gout ka talaga. The other manifestation, no, na ang patient ay may gout is it's because of the movement of the inflammatory cells. Susulat nyo, movement of inflammatory cells. Okay? So, yan. Now, sa dalawang manifestation being mentioned, itong pangalawa, ito yung underlying cause. Bakit kapag may gout ang pasyente, di ba may pain that they felt? Yung pain being felt by the patient, sometimes paiba-iba yung areas, no? Usahay sakit ang toes, no, ang mga joints sa big toes. Usahay sakit ang ankle. Ano sa man ang ankle gani ka na iyahang basta sa feet na siya dapit, no? Yung elbow, usahay sakit ang elbow, fingers, no? So paiba-iba, 'di ba? Yung areas ng joints, okay, that are being affected, no? Kumbaga may pain, paiba-iba, unsymmetrical kumbaga. So ito yung underlying reason bakit there is an symmetrical pain felt by, okay, patients. Okay? So yun yung reason bakit may pain felt. Unsymmetrical pag yun. Paiba-iba yung areas, unsymmetrical. Okay? Dahil nga ulit sa may movement ng inflammatory cells. Now, yung nangyayaring movement of inflammatory cells, of course, that happens because we have proteins, diba, in our body that influences cell movement. Okay? Naatay mga proteins that are important for cell movement. And that is with the help of tubulin. Okay? So this is a protein, very important. Particularly, isa siyang structural protein. Okay? Structural protein. And this is very important for, sulat niyo, this is important for cell movement. Normally, of course, ato ang yung mga cells, okay, the reason bakit may cell movement na nangyayari because of proteins, no, present sa ato ang body. So, meron tayong functional, no, structural proteins. Halimbawa, tubulin for cell movement. So, yun na nga, yung inflammatory cells is able to move because of tubulin. No, we have tubulin. Now, ipasok natin ngayon yung gamot na colchicine. Colchicine. Paano ba ito naging anti-gout? Bakit siya yung first line na ginagamit to manage the condition gout? Now, mind you class na ang mechanism of action, susulat natin sa baba, MOA. Okay, the mechanism of action ng colchicine is that it targets tubulin. Okay? Take note, it targets tubulin. Ayan. So, kumbaga, it causes depolymerization ng tubulin. So, syempre, pag ma-affected yung isang protein, no, ma-change yung form ng protein, that becomes unfunctional already. So, it causes depolymerization ng tubulin. I repeat ha, tina-target ng colchicine si tubulin. Para saan ulit yung tubulin? Cell movement. Now, question, kung targeted si tubulin, do you think may cell movement pa ba? Yes or no? If targeted ba yung tubulin, very good. Pigil ngayon yung cell movement. Tama. Kung pigil ngayon ng cell movement, ibig sabihin, pigil itong movement of inflammatory cells. Diba? Inflammatory cells, cell pa rin yan. Inflammatory cell nga lang, no? But how do inflammatory cells move? Because of proteins for cell movement, the tubulin. But yun na nga, targeted si tubulin, wala ngayong movement ng inflammatory cells. That is why colchicine is used to manage gout. But anong klaseng manifestation lang yung tina-target niya? Yung movement of inflammatory cells. Okay? Kumbaga, pinipigilan niya yung pain being felt by the, diba? Yung pain felt by the patient. Kaya first line nga yung colchicine. But ito yung tandaan nyo, class ha. Siya yung first line in the management of gout, but wala siyang effect to lower uric acid. Kasi nga, yung MOA niya, tingnan nyo, balikan nyo yung MOA niya, ang tina-target na lang naman niya is tubulin. And tubulin has nothing to do with uric acid. 'Di ba? That is why, kapag gumamit ng colchicine, meron talaga yung kaakigbat na other agents, no? Binibigyan yung pasyente ng other agent na nagpapababa ng uric acid din. Kasi nga si colchicine, wala siyang effect towards the uric acid. Wala siyang power to lower uric acid. So, yan. So, kung titingnan natin, di ba, ang action ni colchicine, i-relate natin siya ba as functional modifier? Able niya, na-alter niya yung biochemical activity ng cell. Di ba? Na-alter kasi niya, na-target niya yung tubulin, so na-alter niya yung normal, no, nga movement, no, yung activity ni tubulin. Ano dapat yung activity ni tubulin? Cell movement. Itinarget ni colchicine, edi na-modify yung function ngayon ng body. Wala na ngayong movement ng inflammatory cells. Okay? So, it is considered functional modifier. Okay? So, I hope you understand why this is considered functional modifier yung colchicine. Okay? So let's have the last example for modifier ng functions. We have omeprazole. Okay, so this is another example ng drug that alters functioning of cell in the body. Okay, so familiar man siguro, maybe some of you are familiar with omeprazole. Diba? Para saan yung omeprazole? Anong klaseng condition naman yung omeprazole? Para saan? Okay, very good. Pwede, ulcer. Yes, or hyper, what? Hyper what? Okay, so this is classified actually as proton, okay, pump inhibitor. Okay, if you are familiar with PPIs, yan yun. Okay, so this is classified as proton pump inhibitor. And yes, tama po, it is used in the management of ulcers or management of hyperacidity, for example, no, hyperacidity. Now, question, bakit with this MOA, no, with this mechanism of omeprazole, kaya niyang ma-manage yung hyperacidity? Diba? Proton pump inhibitor, ini-inhibit niya daw yung proton pump. Ang tanong, ano ba yung proton pump? Bakit kapag na-inhibit yung proton pump, pigil yung release ng acid sa stomach? So, yan yung tanong muna. Ano ba yung proton pump? No? Ano yung proton pump? No? Bakit kapag na-inhibit siya, yung proton pump, pwede siya gamitin against hyperacidity. So, wala munang gamot ha, hindi ko muna ipapasok si omeprazole at sang i-analyze ano ba yung proton pump. Kasi when you understand the normal physiology, kapag pinasok na yung gamot, you will appreciate. Kaya pala dapat yan yung gamot. Okay? So, you have to study first the normal physiology. Kaya nga inaral nyo muna yung human anatomy tsaka physiology bago yung pharmacology. Okay? So, somehow, you have a background on the normal physiology ng body. No? So, again, alamin muna natin ano yung proton pump. Okay? Yung proton pump, this is also known as hydrogen potassium pump. Okay, hydrogen potassium pump. This is actually an example of a carrier molecule. I will introduce this already because this will also be mentioned sa atong mga topics under pharmacodynamics. Para pag na-mention ko ulit yung omeprazole, you know already, no, the action of omeprazole. Okay? Now, when we say carrier molecules, these are actually molecules, yes, molecules that are considered cell membrane proteins. Okay, so meaning nasa sila sa cell membranes, no? Kung nasa sila sa cell membranes, we expect na may mga binding sites sila. Okay? Halimbawa, this is the cell membrane, no? Meron yan silang mga binding sites, no? Binding sites sa mismong cell membrane, specific binding site. Okay? Which is capable to undergo conformational changes. So, yan yung mga carrier molecules. So, tandaan nyo for now, ang proton pump, isa siyang example ng carrier molecule. Okay? Now, ano yung specific function ba ng proton pump? Para saan? No? Ano yung normal function sa katawan ng proton pump? Okay? Take note class nga ang proton pump, this is important because it mediates the release. Okay? It is important for the release of the following endogenous compounds. We have, for example, acetylcholine. Okay? Sige, ako na lang spell out. Ga-abbreviate, manggid ko usually. Sige, acetylcholine, also gastrin, no? Gastrin, and histamine. Okay? So, yan yung function ng proton pump. Proton pump muna ha. Proton pump. It is very important to release the following endogenous compounds in the body. Gastrin, acetylcholine, histamine. Okay? Now, ano ba yung common sa tatlong ito? Ano yung commonality ng tatlong ito? Meron kasi silang commonality when it comes to their action. Okay? Whenever these three are being secreted, available sila in the body, tandaan these substances influences the release of hydrochloric acid. Okay? I repeat, yan lahat ang common sa kanila. Siyempre, doon tayo sa common nila nga effects. Kapag available yan in the body na release, yan yung magiging expected nga result. They influence the HCl secretion. Okay? Therefore, ang end result, okay, yung end result, kapag yung tatlo na yan na release, nakakapagpataas talaga siya ng HCl, no? Taas yung HCl. Okay? So that is proton pump. No? Yan yung all about proton pump. Now, ipasok natin yung gamot na omeprazole. Okay? Ano sabi natin sa omeprazole? Isa siyang gamot that is able to inhibit proton pump. Listen ha, ang omeprazole, okay, or those gamot ending in prazole, esomeprazole, etc. Usually ending in prazole na ang mga PPIs. Okay? They are able to inhibit proton pump. Okay? So, it blocks the function of proton pump. Therefore, question ko, what will happen to the release of the following? Do you think uh, they will be released or not at all? Okay, not. Very good. Kasi nga, pigil, no? Block ngayon si proton pump, therefore no release, no? Pigil ang release ng lahat ng mentioned endogenous compound. O, question. Ano yung implication nito sa HCl secretion? Kung pigil si proton pump, is it taas ang HCl or baba? Very good. Ibig sabihin, with omeprazole, okay, with omeprazole, bababa, no, ang HCl secretion. Bakit ulit? Kasi bababa yung release, no, ng acetylcholine, ng gastrin, at saka ng histamine. Okay? Question. Kapag ganito yung effect ni omeprazole, pwede ba siyang gamitin to manage hyperacidity? Yes or no? Pag yan yung effect ng omeprazole, of course, no? Very effective siya to manage hyperacidity. Pwedeng-pwede, no? In fact, ito yung tandaan nyo, class. Okay? About omeprazole, about PPIs in general. Okay? Halimbawa lang kasi yung omeprazole. So, generally, kapag PPI yan, proton pump inhibitor yung drug, that is considered the most effective nga gamot for hyperacidity. Okay? Efficacious drug, most efficacious drug for kayo na magsulat ha sa mga word, acidity. Hyperacidity yan. Hyperacidity. Okay? Kaya nga first line, no? First line ang PPIs in the management of peptic ulcer. Yung ulcer, di ba? Familiar mo kapag nagpa-check kayo, tapos diniagnose ng doctor, okay, may ulcer kayo, di ba? Omeprazole yung binibigay na gamot. So, first line kasi siya. No, first line in the management of acid peptic diseases. Okay? Yun na nga, halimbawa, ulcer. Okay, ulcer. Yung gastroesophageal reflux, yung mga reflux, acid reflux, ganun din. That is the first line. Kaya yan yung effective talaga. No? So, sulat nyo lang ha, acid peptic diseases, halimbawa doon, ulcer. Then, sulat nyo din GERD. Ayan. Hyperacidity as well. Okay, first line. Okay? But, we also have other drugs, no? For hyperacidity, di ba? Meron tayong mga antacids. Sige nga, magbigay ng halimbawa na antacids. Antacids. Yan, pwede din yan. O, Almag, aluminum magnesium, yung Kremel S, di ba? Kremel S, Maalox. Pwede din yan, no? Pero yun na nga, hindi siya, kung i-compare, o compare natin sa activity or mechanism of action ng, omeprazole, much more efficacious yung omeprazole. Kasi tingnan mo yung MOA ng PPIs. Yung ini-inhibit nila, proton pump. Okay? In which, mapipigilan yung release ni acetylcholine, gastrin, histamine. Okay? Tatlo. Okay? So, aside sa antacids, nga pwede din for hyperacidity, meron din tayong mga H2 blocker, mga histamine blocker. Okay, sulat ko lang ha, histamine blocker. Okay, particularly yung mga H2 blocker. Okay, kung i-compare natin yung effect nila with PPI, okay, lesser yung effectiveness nila to lessen, no, the HCl secretion, yung H2 blocker. Halimbawa ng H2 blocker ha, yung mga tedine, ranitidine, okay, ranitidine, yung famotidine. Familiar kayo sa Kremel S nga kulay, yung advance, Kremel S advance. Kung titingnan nyo yung generic name ng Kremel S advance, yung kulay blue, okay, may famotidine sa generic name. That is an H2 blocker. Okay? That is why yung Kreml S, pwede din siya, no? To, to manage the hyperacidity. Okay? Famotidine, ayan, lahat na ng tadine, cimetidine, ayan. Yan yung mga halimbawa ng H2 blocker. Okay? They are also good, no, for hyperacidity. Pwede din naman. But yun na, kung i-compare, kung comparison purposes, for comparison purposes, sabi natin kanina, ang PPI, it is able to uh, uh, stop, no, the release, no, of acetylcholine, gastrin, histamine. Okay, so tatlong endogenous compounds ang kaya niyang pigilan na ma-release. Okay? Compare naman sa H2 blocker, okay, histamine blocker, what do you think will be the only endogenous compound na kaya niyang i-block? It's only the, very good, it's only the histamine, no? Yung kaya niyang i-block. Eh, meron pa tayong other, di ba, nga endogenous compound na pwedeng mag-influence pa rin sa HCl secretion. Meron pang acetylcholine. Meron pa si gastrin. So, kahit na-inhibit niya si histamine, meron pa tayong other, no? Other endogenous substance that may influence nga HCl secretion. Kaya kung comparison sa effectivity, most efficacious talaga yung PPI. Okay, that's based on its MOA, mechanism of action. So yun na nga, madali lang talaga ma-identify yung mga PPI, ending in prazoles. Okay? Dito ko ilagay ha. Ending in prazole. You can search that on the internet. Most of the names ending in prazoles are proton pump inhibitors. Meron lang isang exception, and that is the aripiprazole. So you take note of this. All of the prazoles are PPIs, proton pump inhibitors. Halimbawa, lansoprazole, pantoprazole, esomeprazole. Exception lang dyan is aripiprazole kasi yung aripiprazole isa siyang antipsychotic. Antipsychotic. So we will be learning antipsychotic drugs pagdating natin sa maybe semifinals. Okay, yung mga drugs for mental disorders. Okay, so ayan. So take note ha, omeprazole is also a functional modifier. Ano yung inalter niya? Yung function ng mismong cells, no? Yung histamine, function ni histamine, gastrin, and acetylcholine. Ano yung nangyari sa atong normal body functioning? Supposedly, nagre-release ng HCl, so pinipigilan niya, no? Minamanage niya. Hindi niya pinipigilan ng grabe good kay ma-release raman po, 'di ba, ang drug. So mubalik ka, di maguol kay magbalik raman gihapon ang acidic environment sa tong stomach once ma-release na, no, ang drug nga imuhang gi-take. Okay, ADME yung last, 'di ba, last stage ng ADME is excretion of the drug. Okay, yan. So na-alter niya, 'di ba, yung function ng proton pump, isang carrier molecule. Okay, isang carrier molecule. Okay, so functional modifier din siya. One more example under functional modifiers, we also have the NSAIDs or the non-steroidal anti-inflammatory drugs. Susulat nyo ha. I repeat, NSAIDs are also the non-steroidal anti-inflammatory drugs. Now let us find out why NSAIDs are classified under the category of functional modifiers. So we'll start with the MOA of the class NSAIDs. The mechanism of action of NSAIDs is that they inhibit a particular enzyme. They inhibit the enzyme COX or the cyclooxygenases. Okay, cyclooxygenases. So I repeat, the mechanism of action of NSAIDs is that they causes inhibition, they block COX enzyme. Now yung tanong, ano ba yung enzyme na cyclooxygenases? Ano ba yung function niya? Bakit kapag na-inhibit yung enzyme na cyclooxygenase, may anti-inflammatory effect. Saan ba involved yung enzyme na ito? Now, mind you class na itong cyclooxygenase enzyme, this is important in the production of prostaglandins. I repeat, this cyclooxygenase enzyme, this is an enzyme that is important in the production of prostaglandins. And you have learned in your biochemistry class that prostaglandins, these are group of lipids, particularly these are group of physiologically active lipids. Okay. Now, for us to understand why NSAIDs are classified as functional modifier, let us elaborate more on the concepts that is related to the enzyme COX. Okay. Now, since I have mentioned that prostaglandins are a group of lipids, these prostaglandins are actually metabolic products of a particular fatty acid. And that fatty acid is the arachidonic acid. Arachidonic acid, that is a fatty acid. And of course, a fatty acid that came from a major source of a lipid. So, kunin muna natin yung pinaka-major source ng prostaglandins. That is a phospholipid. Phospholipid. Alright? So, it makes sense because ang phospholipid is a hydrolyzable lipid. Hydrolyzable lipid. Ibig sabihin, it is capable to undergo hydrolysis, and kapag na-hydrolyze yan, particularly via the enzyme phospholipase 2, it will produce a fatty acid. Okay? And I repeat, arachidonic acid, this is prone to metabolism. And particularly with arachidonic acid, it undergo major metabolic pathways, and that is the COX pathway or the cyclooxygenase pathway and the LOX pathway. Siyempre, yung related sa mechanism of action ng NSAID is yung sa bandang kaliwa, yung nasa left side, under COX pathway. So we will build more foundation under COX pathway. But i-mention ko na lang din ano yung byproduct or metabolic product ng arachidonic acid under lipooxygenases. I repeat, LOX is the lipooxygenases. Oxygenase. Ayan. So this produces leukotrienes. Okay, so I repeat, the prostaglandin and the leukotrienes, these are metabolic products of arachidonic acids. Alright? Now, focusing more on prostaglandins. Now, let us find out para saan ba yung prostaglandins? Ano ba yung effect niya? Actually, there are different types of prostaglandins. And of course, they offer different effects in our body. Particularly, there are prostaglandins that are important for the normal cell activity. Okay, particularly, meron tayong mga prostaglandins as cytoprotectant or very essential for cytoprotection. Okay, for cytoprotection. When we say cytoprotection, this is very significant to thicken lining of stomach. Thicken the lining of the stomach. Okay. Now that property of a particular prostaglandin's action, thickening lining ng stomach, that is very essential, no? Para maprotektahan yung stomach lining natin against HCl excretion or high acidity ng stomach. Okay, so that's one of the effects ng prostaglandins. May mga prostaglandins na importante for the normal cell activity, cytoprotection. Meron din tayong mga prostaglandins that are being released in the setting of pain and inflammation. So yan yung mga prostaglandins that causes pain and inflammation. Okay? Now, i-mention ko na lang din, with leukotrienes, yung effect naman niya sa katawan once released is that it is it is very important, no, for its constricting effect. Okay? Halimbawa, meron siyang bronchoconstricting effect. Ayan. Although, in some other cases, condition, bronchoconstriction is not tolerated kapag may asthma yung tao, okay, or mga respiratory disorders. Okay, so balik tayo kay prostaglandin. Since I have mentioned already the few effects of prostaglandins, cytoprotection, then may mga prostaglandins, very important for pain and inflammation, ipasok natin ngayon yung gamot na Nsaids. Okay, so I have mentioned kanina that non-steroidal anti-inflammatory drugs, ang mechanism of action nila is to inhibit cyclooxygenase enzyme. I repeat, they are capable to inhibit cyclooxygenase enzyme. Therefore, try to look at the pathway. Inhibition of the cyclooxygenase pathway by NSAIDs, that would further lead to inhibition also of the synthesis ng prostaglandins. Tama? And tama yung pag-inhibit ng prostaglandins, especially in the setting of pain and inflammation, that will cause pigil inflammation. Pigil ang pain. Okay, so yan yung rationale. Bakit yung mga NSAIDs, upon inhibiting COX, they have anti-inflammatory effects. Okay, so that's the mechanism of action ng NSAIDs. However, class, yes, beneficial yung NSAIDs in the setting of pain and inflammation, but you have to take note as well na meron tayong mga prostaglandins that are also important for normal cell activity. And kapag na-inhibit mo yung COX pathway, syempre general prostaglandins will be inhibited yung production nila. Kaya, inhibited din yung mga prostaglandins that are important for cytoprotection. Remember, important yung cytoprotection. This is very important to thicken lining of stomach, protecting our stomach from acidity brought by the high HCl in the stomach. Okay, so yan lang yung negative side effect no ng NSAID. Kaya yung remedy, okay, with NSAIDs, ayan, with NSAIDs, yung remedy para somehow cover, no, or masolusyonan yung pag-inhibit ng mga prostaglandins that are important for cytoprotection, dapat yung patients or consumers ng NSAIDs, they are advised to take the NSAIDs after meals. Okay, after meals. NSAIDs after meals. Again, NSAIDs must be taken after meals. Kasi nga, with meals, somehow protected muna yung lining ng stomach. Knowing na kapag kumain tayo, napapababa yung HCl. So, tsaka ka na uminom ng NSAIDs. Okay? Ano ba halimbawa ng NSAIDs? May phenomic acid, ayan, yung naproxen sodium, okay, yung ibuprofen, etc. Okay? So, there are cases na yung pasyente is given NSAIDs, no, prescribed with NSAIDs, siguro galing nagpa-pull out, no, ng ipin, okay, nagpa-ibot o ngipon, then they are usually prescribed, diba, with mefenamic acid aside from the other anti-bleeding na drug. Okay? So make sure nga if you are exposed to NSAIDs for a longer period of time, then please take note, no, of this advice, no. Dapat after meal siya i-take. Kasi may mga pasyente na nagkakaroon ng ulcers because of NSAIDs. Kaya meron tayong mga tinatawag na NSAID-induced ulcers. Okay? Yung dahilan ng pagkakaroon nila ng ulcer dahil sa NSAIDs. Kasi nga, exposed yung stomach nila with NSAIDs, wala munang kain-kain, nagte-take na ng NSAIDs. Okay? So somehow, based on this pathway presented, you can now rationalize bakit posibleng magka-ulcer, di ba, with NSAIDs kapag hindi siya taken after meals. Okay, so again, recommended time to take NSAIDs after meals. Okay, so far I have discussed 3 examples, no, of functional modifiers. Okay, so yung tatlong example na yan, there are just few of the many examples of drugs that could alter the normal body functioning, that could alter the biochemical activities of the cell in the body. So functional modifier si NSAID because it is able to, ano yung ginagawa niya? Able to inhibit, diba, an enzyme. Okay? So that is a biochemical activity ng cell. No, na-inhibit niya yung citric reduction, na-inhibit niya yung bioactivity na pain, tsaka inflammation. Okay? Now, most of the drug classifications will be discussed further on the preceding modules natin are also considered functional modifier. Okay, so that will be discussed naman under pharmacodynamics principles. Okay, so let us proceed on the next classification of drugs. So we're done with functional modifiers. Let us have the replenishers. Now, from the term replenisher, ibig sabihin to supply, no? Replenish, that means to supply. Okay, to supply the lacking, what is deficient, what is being yung kulang, no? What is being lacking, then we simply supply. So may mga replenisher. So they are considered supplements. They supply what is lacking. Now these agents, particularly, they supply lacking endogenous substances, okay, naturally occurring sa katawan or that are essential in the body. So halimbawa, yung mga electrolytes, di ba? May mga cases na mababa yung mga electrolytes sa katawan, nagkakaroon ng hypokalemia, hyponatremia, hypocalcemia, yun. So we simply supply electrolytes. Diba? We have different electrolytes. So kapag mababa yung potassium ion, you supply potassium chloride. No? Kapag mababa yung sodium ion sa katawan, we supply sodium chloride. No? Ganun. So halimbawa ng mga electrolytes, potassium chloride, sodium chloride, calcium chloride. So makikita itong mga replenishers na to sa mga, usually sa mga inumin, di ba? Mga hydrates, mga inumin. Okay? Kapag dehydrated ka kasi mababa yung mga electrolytes sa katawan. So you try to replenish its supply with hydrates. Okay? Another example under replenisher, vitamins. No? They are also known as minerals that are required for the body to work properly. Diba? Example, kapag mahina yung immune system natin, ano yung vitamins na kailangan kapag related to immune system? Is the vitamin C. No? The vitamin C. And there are other vitamins pa, no, available in the market. So vitamins are classified as replenishers. Another example are the insulins. No, insulins kapag mababa yung insulin sa katawan, by the way, para saan ba yung insulin? Insulin, that is a hormone, no, that regulates or lowers blood sugar level. So yung problem kapag mababa yung insulin, wala nang magkocontrol ngayon sa blood sugar level. Kaya tataas yung blood sugar level. Kaya may hyperglycemia. Okay? Or the condition related to hyperglycemia, this is also the diabetes mellitus. Okay, diabetes mellitus. So, if mababa yung insulin, then we supply, we supply what is being lacking. So, supply insulin therapy. Okay? Or other nga hypoglycemic agent para ma-neutralize, no? O mapababa yung uh, yung glucose level in the blood. Okay, so that is under replenishers. Then we also have the diagnostic agents. Diagnostic agents naman, these are substances or agents used to diagnose, no? Examine a body in order to detect abnormalities or any impairment sa body's normal functioning. Kumbaga, with these group of agents, they are able to evaluate or detect what is the existing disease in the body. Kasi diagnosis, diba? We are predicting here a particular disease. So halimbawa, we have tensilon. Tensilon in particular, this helps the doctor diagnose myasthenia gravis. Okay, myasthenia gravis. Okay, or this is all about weakness of muscle. So, tandaan niyo lang muna, all of this will be discussed under ENS drugs. Okay, so tensilon, this will help the doctor diagnose weaknesses in muscle or particularly myasthenia gravis, an autoimmune disease. Technetium 99M, ito naman, this is a radioactive agent that could detect coronary artery disease. Yung thallium na scanner naman, that could be used also for diagnostic agent. Particularly, this could detect or examine the heart to obtain information about the blood supply of the heart. So it has something to do with the blood supply of the heart. Okay? And then lastly, disopyramide and dobutamine, isa itong stress test. Okay? Stress test. Baga, it helps the doctors determine how the heart is functioning, okay, by inducing stress to the heart. Okay, so with this, it could assess the heart's function or the heart's structure. Okay, then lastly, we have the chemotherapeutic agents. I think you're familiar with this already. Ang mga chemotherapeutic agents, they are the ones that inhibit growth or they kill the cells, okay, that are considered invaders or foreign in the body. So we have anti-infectives, anti-neoplastics, or the anti-cancers, okay, anti-cancer drugs, okay, anti-neoplastic or the anti-cancer drugs, okay. So overall, we are done with the general classification of drugs. And so to end lesson 1, under module 1, let me remind you about the basic premise or basic statement. Now, this is a basic statement that for every pill, there is an ill. Okay, so not the other way around. Kasi lahat ng available na medicine in the market, meron yang specified na condition that it controls, that it treats, that it manages. Okay? Take note, all drugs, medication, they are potentially harmful since itong mga substance na to are not essential to the body's normal metabolic needs. Kaya nga, meron lang specified na dose per medication. Okay? So, higher concentration of that medication, that already causes harm, no? Harm sa body.